Can she go back to work?
Absolutely. Yeah. There we go. Good. Already on her leg veins, she has just tiny little ones. Which ones bother you the most, would you say?
There's some behind my thighs.
Okay.
And then right in these areas.
This area, okay.
And then I get them in my ankles pretty bad from the pressure of standing all day.
All right, so we're gonna get started. We use, for leg veins, it's a 3-tier system. You have the deep veins that are called the varicose veins, but they're deep, but they get incompetent valves, which means they're not functioning properly, so they start to bubble out through the skin. And when I say that, I mean that you can see them through the skin. They're the ropey ones that are really unattractive. Unfortunately, you don't have any of those. And then the middle system is the reticular veins, and she doesn't really have very many, but they're the bluish veins here. And then we have the superficial ones on top. So if you have varicose veins, you really have to treat those first before you actually start doing the superficial ones, or the pressure of the deeper veins is just going to pop those superficial ones open again. We clean off the area with alcohol, and then we get started. Now, Brienne has kind of harder ones to do because they're really pretty tiny, and so that makes them a little bit more of a challenge. Sometimes they're pretty big, so we'll start on the ankle since I'm right here. Okay, and we can see them right here. We use different treatments for doing leg veins, and one of the main treatments is glycerin, which is my favorite because it isn't hyperosmotic and it doesn't cause as much pain or discoloration or ulceration, because those are the 3 main things that you can get when you do leg veins. And you can see hers are really tiny in them. They're kind of a challenge to get. When you hit them, it's really beautiful. Because you'll see it'll clear the whole vein, all the veins in the area.
I just wanted to keep it interesting for you.
Mm-hmm. Yes, makes my job hard. I love it. I love it. There we go. Causes are mostly hereditary. That's going to be one. Having a baby, because the pressure of the baby on the leg veins makes these pop out. And then you also have standing. And Brandon's the best hairdresser. I better not say that because Michael will get mad if I say that. Michael's the best hairdresser and Brandon's the second best hairdresser.
So we have Kimber said, my hubby has them bad. Do the stockings reverse prevent more? Should I wear them when I stand for hours?
The compression stockings is really beneficial for preventing them from getting worse. It's not a cure though, so if he has them, he really needs to go and get them treated. It's the only way to reverse them. And if they're really bad, probably needs to go get an evaluation, an ultrasound evaluation to make sure that he doesn't have the deep system involved. So this is more for the really superficial ones. And usually younger people are good candidates for this, or people who have done the deeper veins first. With the deeper veins, they're going to take a laser inside the vein and coagulate it so it closes off, or you can do it with a radio frequency. So you can see I'm getting some of these veins. These are a little bit easier, thank goodness. Because I've done this for a long time and I'm usually pretty successful at it. Well, not pretty successful, very successful. There we go, you can see that, there we go.
Why are we lasering them, doctor?
Lasers actually, a lot of people will say you can do lasers, and unfortunately the lasers just don't really work because the vessel goes across for a little while, then it goes deep, and then it goes back up. So you can't the laser just targets little points along the vessel, and so it heats that part of the vessel, but it doesn't get the deeper components, so it doesn't really work. And we have every laser that's supposed to work for leg veins, and I used to spend a lot of time testing different settings on the laser to get it to work. It just really never was successful at all. Can you see those blanching?
Yeah, you can see blanching.
Okay, good. Okay, we'll get this one here.
Does it hurt?
That's a question.
It's like a little prick, but I got a lot of meat there, so.
I get these leg veins done myself, and I don't think it hurts that bad. It's sort of startling, though, if you're a chicken like I am.
No.
You're much braver than I am. You're not even flinching. Could I get a new needle, please, Lee? at some of these.
Is this a one and done treatment?
The answer to that is no. You typically need a series of at least 5 before you'll get them cleaned up. Thank you, Lee. So we're gonna change out the needle. A series of 5 to get them cleaned up, and then you have to do maintenance treatments. I've been working on mine for probably 5 years, and I go in once every couple months and have them treated, unfortunately.
Is that what you would suggest then for somebody in my field?
Yes. Yeah, for you, every 2 to 5 months.
Doctor, can you repeat recovery? You have a couple weeks left.
The recovery is pretty simple. We wrap here, and we just keep the wrap on for a day, and then afterwards, that's it. That's really all there is to it. And it's very satisfying. What's that?
When patients ask for rapid treatment, do they compression stocking, like for how long?
Well, we don't really, for the superficial ones like this, you really don't have to wear them for very long, just 24 hours. That's all we say. Now, some studies say it'll work a little bit better if you wear compression for a couple weeks, but I don't think that's really necessary. Yeah, here's a deeper one we're going to try to get. That sort of blue screen one. Let's try this one here.
They're commenting that it's very satisfying to see them.
It is. When we hit a good one, it is. I'm trying to find a good one that I can give. There we go. There we go. Here's our super teeny. So they're really kind of hard to cannulate. All right, those look good. What do we have over here? And we have some on the back too, is that right? There we go. Okay, so let's have you roll over on your stomach. Oh, we've got some good ones back here. These will be easier to get too.
Oh, I'm so sorry.
You okay?
I just hold my hands in. That's okay. And then what will she see? Like bruising, or did you go over?
With this, you get a couple bruises. Sometimes you can get, there we go. See, when you get it, they blanch out the whole area. Because what it does is the glycerin gets inside the blood vessel, and it irritates the blood vessel wall, causing a clot to form and the vein to go away.
Oh, we got an amazing comment. Camera duty walk. They need to use it more often.
Thank you for the support here. Okay. So hers are very fine, so they're not as dramatic as some that we see.
Can she go back to work?
Absolutely. Yep. There we go. There's another good one. All right, and I think we're finishing up. I've been doing this so long. I can usually do a whole leg in 10 minutes or less. Here we go. You can see that's a great one. And she has some little fine ones here we can work on. There we go. Are you seeing these? Got good at this, doing it on my professor when I was at Tulane. And we'll just do this one and we'll be finished up. Okay, well, thank you guys for tuning in. That's a little intro to sclerotherapy. And if you have leg vein issues, please contact us at Contour Derm. We'll be happy to evaluate whether you need deeper vein treatments or more superficial treatments. And thank you for your support on Instagram, Facebook, TikTok, and YouTube.